Okay, thank you very much, Professor Khanna, for the privilege to be part of APVIC 2021. We are grateful from Nigeria. So let me share my slides. Yeah, thank you very much, Professor Khanna. It's a privilege to be with you again. Not just training, but also mentoring us day by day. If we run into difficult cases, we do call you. So I just take a 3-year review of foreign bodies in the heart and vessel as we see them in the country. Foreign bodies in the heart and vessels are rare. They are usually iatrogenic. Embolism and arrhythmias may be part of the complications when they present, and they are usually diagnosed with an X-ray, CT, chest, or even on echocardiogram. They can be easily picked up, and they can be managed by either conservative. Can you hear me? They can be managed by conservative or
sorry about that. You can continue.
Endovascular, percutaneous, or surgical method. So the objective of this review was to describe what we have been seeing at the Bayelsa Specialty Hospital and the Cardiocare multi-specialist hospital in Abuja, where we have a lot of referral. So the method here we used was a retrospective cross-sectional study. We searched through the cardiac catheterization of these two hospitals from January 2018 to 30th of April 2021, and we have 11 foreign bodies. So we look at the site, theology, and the clinical presentations and the data we analyze. So the results, we have about 58. The mean age was about 58, and we have more of men than women. So the most common foreign body was seen in the superior superior vena cava, the right atrium, and the inferior vena cava. Then also we also noticed that those that are above the age of 60, we have about 6 of them. We are above the age of 60. As we said, we have guide wires because of central line placements by the anesthetists. Some of these guide wire fall into the veins, and they are lost in the veins, so we'll be called upon to come and take them out. Then also radial intervention is also increasing in the country. So we have one case of guide wire loss during radial puncture. Then IV cannula was also into the pulmonary circulation, tolerance, and you can see the rest of them there. So how many of them were symptomatic? We saw that 4 of them were symptomatic, and the symptoms they presented some of them were this atrial atopics, ventricular atopics, and non-sustained ventricular tachycardias. So we have a total of 81% presented within 24 hours. My time is almost up. So the time of presentation, we see that a number of them presented faster because of when you are told that you have a foreign body in your body, it always caused anxiety and panic among them. So the complications, as you said, we have a few of them that presented with some of the ventricular atopy because some of them went into the right atriums and were causing intermittent and non-sustained VT. Mortality, we have no mortality during the treatment, and they all had this. Among them, about the 11, 9 of them had endovascular treatment. So you can see one of the case here. Hope you can see here that this was a tunnel catheter for a port for hemodialysis, and after that, the surgeon was about to take it out, and he got broken and went into the right atrium, extend into the right ventricle. So the first thing we did here was we can see that I got the catheters, and we pull it out, then into the SVC. From the SVC, we got a locally made a snare. Then you took it out, and this was the final stage of taking it out. And when it was taken out, we measured it and it was around 27 centimeters. So this was another guide wires. Also, the anesthesis was actually to set a central line. And before you know, the guide wire slip out and enter into the SVC, migrated to IVC. And this was the time it was shown to us the same day. We took it out, and this is when, after it was taken out, the final flow room. So the management of foreign body in the heart should be individualized. Symptomatic foreign body should be removed. Asymptomatic foreign body can also be removed. But if they are like is a very small fragment of a broken cannula, and because and are migrated to the distal end of the pulmonary artery, you may not bother to take any such things out. So foreign bodies in the heart and a vessel may be symptomatic or asymptomatic. They are usually iatrogenic, and they can be managed appropriately when referred to the specialist. Thank you very much for the privilege to present.
Very much. You were enjoying your talk very much. And every day we feel so good hearing your good work.